Thank you, Mr. Moderator. I think let me start off. There's an organization somewhere when you start a speech where you say all protocol observed. So I'm going to start off, Minister, by saying all protocol observed. It came from an organization, I think. But I think let me, whilst I observe all protocol, let me acknowledge three people. I think firstly, Isaac Shongwe of Barlow World for hosting this, and I think Isaac, you had inputs into the establishment of the institute, and then I think secondly to Dr. Percy Matlati and the African Institute of Health Leadership Development. Thanks for inviting me to be part of this panel. I think we're discussing some very important issues here today. And certainly we appreciate this new think tank that's been developed, and we're quite certain that it will go from strength to strength based just purely on today's interactions. I have no doubt that you will play an important and continued role in the development of healthcare in this country. Finally, Minister, to you, it's always a great inspiration to listen to you speak. We can never match your passion or enthusiasm, but we'll certainly try and do that today. And I think with those words of trying to emulate passion and enthusiasm, I think what I've decided to do today in the 9 minutes I have is approach this from a vantage point of practically how can we try and build a common national strategic agenda in healthcare. So I'm going to try and use some practical examples that are real live examples that we engaged with currently. And I'm hoping that through these practical examples we can engender and harness other examples. And I think for me it's all about the public and the private sector finding each other, working together and taking the country forward. So before I refer to these practical examples, I guess we need to reflect on what should inform a national strategic agenda in health. And I think for me there are three things there that we need to recognize. The first is, no matter whether you're sitting in the private or the public sector, for me there isn't a private and a public sector, they're South Africans. And I think as South Africans we need to recognize that the social and economic challenges that face our country are directly the cause of poor health. And this poor health is naturally exacerbated by HIV, AIDS and TB, a phenomenon which a minister, or pandemics which a minister indicated, are really unique to this region. The second acknowledgement we need to make is that these challenges are naturally reflected in the outcomes that we're seeing. The outcomes that we're seeing are low life expectancy, increased maternal and child mortality, and many others that I don't have the time to go into. The third acknowledgement in terms of informing this agenda should be the need to improve the healthcare system as a whole in order to improve access and increase quality of public health services, to reduce the disease burden, and to build a platform for the introduction of NHI. So I think in my view, ladies and gentlemen, those are some of the key issues that would inform this national strategic agenda. So what then might be the key elements of a national strategic agenda? I think the first is the need to have a cooperative and mutually beneficial partnership between the public and the private sector, as I indicated earlier. And I think in doing so, it's essential to start leveraging the skills and the funding that resides across these two sectors. It's key to increase efficiencies in the healthcare system across the board, and it's important to start implementing together as a collective the MOH's strategic priorities. The second element is that, in my view, there's significant mutual mistrust and confidence lacking between the public and the private sector, and we need to find mechanisms of bridging this. I think we're very good as South Africans at bridging gaps, whether it's ideological gaps or operational gaps, whatever it might be. I think we're very good at doing that, and I think we need to start finding each other, build that mutual trust and that confidence. Without that, you can't do any of the things that any of the speakers have discussed here this morning. And then I think lastly, we need to start understanding each other. I was in a private sector forum the other day, and it was interesting, Minister, how few people knew what the NSDA is. And I suspect if I ask people in this room, I might get a similar response. But yet, that's the agreement that you've signed with the President in terms of the outcomes that are, I think in the private sector, we call it the KPIs. So I think it's important that we start finding each other and understanding these issues. I think when you understand these things, then you can start building a common national strategic agenda. So let me end off, ladies and gentlemen, with two last things. I'm going to give you some of the examples of how, as a private sector, we're trying to work together with the public sector to harness what I'm saying. And then I'm going to do one very brief, in my last minute, Faisal, that I'll have a response on some of the pharmaceutical issues as best as I can, remembering that it's one of the 10 priorities in the plan. The Minister earlier referred to a meeting with 16 chief executives last year. And how that meeting came about, it came about through various bilateral interactions the private sectors had with the Minister. And the common theme there was that we need to work together to build a better healthcare system. So a group of us sort of got together and said, well, how can we take this forward? What is it that we need to do? And we certainly don't want to confine it to a group of 16 companies. We want to make it a lot broader than that. But you've got to start somewhere. And I think when you start somewhere with new initiatives, you come in for a lot of criticism. But I think you've got to show the boldness and the courage, and you've got to move forward. And many people that are sitting in this room are part of that group of 16, which, by the way, has expanded now. And we're hoping together with the Minister to launch this initiative towards the end of May. So what it's going to involve is it's going to involve setting up a public health enhancement fund, Faisal, which is not new. Okay, the concept's not new. But what we would be doing, and what is groundbreaking, for the first time, we would get representation across the entire private healthcare sector. So you're not confining it to one sector, because it's easy for me as pharmaceuticals, we can come and see you, Minister. We say, you know what, the bad guys in the room are the hospitals. And then the hospitals come and see you, and they say the bad guys are the funders. And so we play this blame game, and it continues indefinitely. We never wanted that. We want to come together as a private sector and say, Minister, we're setting up this fund. We want to work with you. We want a dialogue. We want to engage on the key issues. And you've welcomed this initiative, so of course we're very happy about that. But it's a lot. It's quite difficult putting it together. We've made great strides forward. And as I say, we said we would have 2 more meetings with you, a pre-meeting and then a launch meeting. We're planning that for May. And I think that it will be trend-setting. I think the healthcare sector in this country will be trend-setting, because no other sector, whether it's mining or financial services or any other sector, no other sector is doing, I think, what we're going to be pulling off later on. There's been charters, etc., but they're not as progressive, in my opinion, as what we're looking to achieve here. So let me just say that what we'll do with this fund is we're going to jointly select projects with the department. And the department, the Minister said earlier, there are 2 areas of focus, HIV, AIDS and TB, and then the human resourcing and management capacity building. So we've already, with the DG, we've been working with the DG, we've identified 3 HR/management capacity building exercises or initiatives, and they include the following. The first one is around a health professions intelligence center. What do we mean by that? Minister spoke about us literally being at war. It's a war of pandemics. And when you're fighting any war, you need to know where your resources reside. You can't be fighting in Normandy when you're under attack in Paris. You've got to know that if you're under attack in Paris, you've put most of your resources in Paris. So take someone like myself, who's a registered pharmacist with the Pharmacy Council, but I don't dispense a single pill, Minister. Maybe I need to on the weekends. Thank goodness. But in the register of the Pharmacy Council, I'm one of the 12,000 pharmacists there. Okay, there's probably 5,000 of us, either sitting in Toronto, Sydney, or sitting in business like I am. But when you look at the register, it shows 12,000 pharmacists. So this intelligence center will allow the mapping out of where these resources reside. Are they in fact active resources? And how are they best utilized? Where are they best deployed? So that's the first initiative. The second one will be to produce more health professionals, whether it's medics, whether it's pharmacist assistants, whatever it might be, dentists, nurses, etc. So that's the second one. It's a no-brainer. It's an obvious thing that we need to be doing in the country. And then the third is an Institute of Leadership and Management. For me, after the Intelligence Center one, this is the next most important one, I think, in terms of a short-term gain. What do I mean by that? If you look at the budgets that some of the CEOs of hospitals are running, some of the budgets are 2-3 billion rand. If you are able to get, through better management skills, better qualification, a productivity gain of 5%, for example. 5% on 2 billion is 100 million rand. So it's not insignificant, and you can do a lot with 100 million rand. So I think these are the type of projects that I think through a social compact, which is another key area the Minister highlighted. And these are practical examples how ordinary South Africans in business can start partnering the public sector, and we start delivering these things. Now, I know we haven't got this off the ground, but we're very confident we'll get it off the ground. And I think it will show the way for other sectors and other parts of society to engage in similar types of partnerships.